Hello, hello. This is Dr. Grace. It is Monday night, 8 p.m. It's time for Medical Monday. So, could you please like, invite, and share as you guys come on? We're going to be talking about nerve damage tonight. It's a lot of information. Um, someone requested this, so thank you so much for the message in regards to me doing a talk about nerve damage. So, if you have a request on a particular topic, please message me so we can get it on the roster or the books or whatever you want to call it on the programming. How about that? On the programming for us to have it as a topic of discussion. So please like, invite, and share. Hey, Tanisha, thank you for coming on as Medical Monday. I am Dr. Grace Patterson, affectionately known as Dr. Grace, managing owner of Bethesda Holistic Center and Everything New. Where we provide concierge services. And what is that? You need to find out what that is about. Yes, that gives you personal access to me via video chat, be it texting, be it phone calls in regards to your health. So a lot of people are getting involved in that. But guess what makes us different than any other concierge services that is out there? Most of the concierge services involve allopathic medicine, which is traditional pharmaceuticals. But at Bethesda Holistic Center, we treat the whole man from spirit, soul, body, and we do natural alternative remedies. So that what makes us second to none. Hey Cassandra, hey Dion, hey Lynn Clover, hey Cassandra, hey Tanisa. Please like, invite, and share. We're going to be talking about nerve damage tonight. Someone made a request. If you want me to talk about a particular topic, please message me at Medical Monday or my personal Grace Patterson, whichever one you would like, and let me know what topic you want us to discuss, and we can put it on the programming. So please like, invite, and share as you come on. We are now on Facebook Live Medical Monday, Instagram Medical Monday, and YouTube Medical Monday. So please share these videos for you replayers that can't make it at Monday at 8 and you go back and look at the videos. Please, thank you when you please like and share as you come on and watch. We're going to be talking about nerve damage on tonight per request of one of the people who come on Medical Monday. Thank you so much for doing that. Hey, Regina. Hey, Miss Mazine Robinson. Hey, Miss Diana Brown. Please like, invite, and share as you guys come on with your Facebook friends and family. Hey, please get them on so we can talk about nerve damage tonight. I'm Dr. Grace Patterson. And if you want to get in touch with us, our website is www.b as in Bethesda, W as in holistic with a W, bw-center.com is our website. Our telephone number is area code 248-356-1111. That's 248-356-1111. We provide a whole myriad of services. For those of you who don't know, we also have a primarily a visiting physician practice where we bring the doctor's office to the sick, shut-in, elderly, seniors, people that it's a taxing effort for them to get out of the home. We take the doctor's office to them, and most of that is Medicare with a combination of Medicaid. But we also provide concierge services, which is a year membership, which allows you to have personal access to me in regards to developing your health mapping, which I've talked about extensively on Medical Monday, where we find out where you are right now and get you where you want to be in regards to your health. And what makes us different from any other concierge service, we provide alternative medicine, which means herbs, which means supplementation, which means diagnostic testing that is not traditionally done by your primary care physician, which includes vitamin testing, excuse me, antioxidant testing, neurotransmitter testing, and hormonal testing. So we pride ourselves on being able to address situations or health issues emotional, mentally, physically, and spiritually. So we treat the whole man. Yes, we go. We do that through our concierge services. So if you want more information in regards to that, please reach out to us at www.bw-center.com, and our telephone number is 248 356-1111. That's 248-356-1111. Did you guys know every day 11,000 people, every day 11,000 people, that's a lot of people, turn 65 every day. 11,000 people. That is an astronomical amount of people that turn 65 every day. And so we do pride ourselves on the visiting physician practice, where we take our um, the doctor's office into the home. So, like today, we had a situation where a gentleman had a productive cough. His daughter was very concerned, so we were able to call the X-ray people, and she said it was a while before he had EKG and echo. We called all of that stuff. They were out at his house after Dr. Grace made a phone call within an hour, and I got his chest array X results within a few hours. So we pride ourselves on providing prompt, consistent, and thorough evaluations from the Medicare side all the way up to the concierge services that we are able to provide for those that are interested in our services. So please reach out to us if you are more, or if you're interested. Go to our website, www.bw-center.com. Telephone number 248-356-1111. That's 248-356-1111. So thank you guys for joining on. We're going to be talking about nerve damage tonight, per request of someone that's on faithfully on Medical Monday. If you have a topic, please message me so we can get on our programming. So tonight I'm going to talk about acute nerve damage, and then we're going to segue into chronic nerve damage. Guess what, guys? Everything that I have talked about to this point, it is a building block in regards to how God created and designed for you to function, how God created and designed you to put yourself in a position for you to have promote self-healing, and I talk about that all the time. So one of the things that was really amazing to me, now I most of the time get my information from Harvard, Stanford, Yale, and different medical websites that doctors use. This particular one is called Medscape. And I put nerve damage in there, and then I came up, popped up was one of the topics was acute nerve injury. And the history of it, they quote the Bible. Yes, I'm so excited about that. They quote the Bible. And so since I'm going to be touching on the Bible a little bit, I always like to give accolades to my spiritual parents, Apostle Wayne T. Jackson, Dr. Beverly Y. Jackson, who are my covering, and who birthed Medical Monday through Medical Minute through Great Faith Ministries International. And we used to do video announcements. One of the passions, or one of the part of the vision, 10-point vision that was given to Apostle Wayne T. Jackson, was to treat the whole man. And not only is Apostle Wayne T. Jackson concerned about your soul being saved and going to heaven, and being financially prosperous, but also part of your prosperity is part of your health. So I have been there this past August for over 20 years now, and I have seen this man and woman of God have a desire to see people whole in every area of their life, including their health. So let me get to the topic at hand, which is called acute nerve injury. Where they talk about the history. They say report acute nerve injury can be traced back 3,500 years ago. Is there anybody out there that knows the Bible story where it talks about someone who had a nerve injury in the Bible? This is kind of like trivial. Do 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 do. Does anybody know? Can anybody comment in the comment section in regards to where the Bible talks about someone, a Bible character or someone in the Bible having a nerve damage? Does anybody know that story? And when I do tell you what the story is, you're going to be like, oh, is that what that was? Does anybody know? Anybody? Hello, Miss Mazine. Hey, Dion. Hey, Sinitra. Hey, Twana. Hey, Brother Green. Is there anybody out there that know? Can anybody in the comment section tell me what the story is where there is a acute nerve injury? Anybody? Does anybody know? I'm looking in the comment and I don't see anybody commenting or saying anything. So I'm gonna go right and go out, come right out and tell you. It was a biblical story of Jacob. Jacob, before he became, God changed his name to Israel. Jacob suffered a sciatic nerve injury with a traumatic dislocation of his hip when he battled with the angel in Genesis 32:25 through 33. However, no specific technique to repair the peripheral nerve damage was described until the 16th century, but it can be documented back biblically, an acute nerve damage injury when Jacob was wrestling, when he went to lay his head down on a rock to go to sleep, and he saw angels descending and ascending on the ladder from heaven, and he grabbed one of the angels and he fought with him all night, and he said, I'm not going to let you go until you bless me. And the angel was like, okay, I see you ain't gonna let me go, so let me hit you on your hip so you can so you can let me go so I can do what God has called me to do. So that is one of the documented acute nerve injuries with the sciatic nerve. And a lot of people are like, well, where is that located? Well, there's a hip dislocation. What it happened when the angel hit him on the hip, your hip, this is the like the ball and socket, so this is the hip joint, the hip part of your leg. It sits in here like this, and then when he hit him on his hip, it came out like this. So what happens, there is a big nerve called the sciatic nerve, these nerves that come off the bottom part of your spine and come together and go around your hip and go through your butt cheeks. You have these are butt muscles, and it goes through a little hole and then it goes all the way down your leg, but it travels around that big bone. So when he hit Jacob on the hip, that hip became dislocated and damaged that nerve. So that's the first documented sciatic nerve acute injury was biblically. So, but Gabriel Fiera, in the 1500s, like 1543 to 1627, was the pioneer for peripheral nerve surgery. So, yes, if there is some type of nerve damage, yes, it can one be repaired, two can regenerate, and yes, your body has the capability to regenerate certain nerves. We are taught in medical school years ago certain nerves don't regenerate. And it depends on the location, it depends on where it is, and how badly it may be damaged. But there are certain situations, I do believe in miracles. Even though medical science says something that can't be done, we serve a God that miracles do happen. All right. So let me go on to talk about the definition of nerve injury. A definition of nerve injury is classified in 5 categories. There's a whole bunch of medical terminology that I'm not going to bore you with, but if there is some providers under the sound of my voice, other doctors, nurse practitioners, physician assistants, or anything like that, nurse practitioners or medical assistants or anything like that, the significance is called SEDDON's, SEDDON apostrophe S, 3 grade classification. Even though it's called 3 grades, there's 5 parts to it. And I'm not going to go through all the names of it and all of that kind of stuff. So if you want to look it up at your leisure, you can do that. So there is the classification of nerve injuries based on damage sustained by the nerve and components, by nerve functionality, the ability for spontaneous recovery. And again, that's Seddon, SEDDON, published his classification of nerve injuries in 1951. So those are the types of classifications of nerve. So there is neuropathic pain. Yes, I deal with that a lot in my healing clinic. For those of you out there, we call our clinic because we deal deal with people that primarily have pain issues. I did not want to, because I believe in the power of words. I did not want to continue to call it a pain clinic which is the norm out there. I want to call it the healing clinic. And the reason why I want to call it the healing clinic, because I have seen people uh, um, through the unctioning of the Holy Spirit, and with my with God grace me with the knowledge, people get better. So I give God the glory on all of that. So we call our clinic the healing clinic. So neuropathic pain, uh, oh, all these medical terminologies. I'm trying to figure out how I can describe all of this without using all this medical terminology, but I guess I can tell you the name and tell you what they mean by that. A nerve injured produces a long lasting neuropathic pain. What does that mean? That means that the nerve is injured, it can be swollen, it can be inflamed, and it can manifest as what we call allodynia, AllodYnia, a decrease in pain threshold by hyperplasia, which means hyperplasia. Hyper means a whole bunch, plasia means cells, and as an increase in response to noxious stimuli. So a nerve can be injured and it's trying to work. So if it's trying to work and it's injured, that's what causes the pain. So what do we do to help with neuropathic pain? Okay, you've seen all these commercials out there. Diabetic neuropathy is what we call neuropathic pain. And I explained to you guys before what causes that. Your body is so smart, when it doesn't utilize the glucose or the sugar like it should, it says, hey, this is too much sugar. I need to turn it into something. And your body turns it into sorbitol, which is SORBITIOL. Anything that ends in an OL is considered alcohol. So that sorbitol goes around those nerve endings and it causes a burning sensation, a hot sensation. That's why people that have neuropathy pain feels hot, burning, or some needle prickly feeling. That's because in diabetic neuropathy, that sugar is turned into alcohol. So that is why it's so important for any of you that is under the sound of my voice that have a diagnosis of diabetes. That is why they are on you about getting your eyes checked every year. So a person with diabetes don't get diabetic retinopathy, which can ultimately turn into blindness. How do you prevent a person with diabetic neuropathy from going blind? Control the sugars. Got to control the sugars. How do you control the sugars? By what goes in here. Remember what I told you. Life and death is not only in the power of the tongue by what you speak, but it's also about what you put in your mouth. So the best way to treat diabetic neuropathy or neuropathic pain, which is a form of nerve damage, you have to have tight control on your sugar levels, on a person's sugar levels. That's very, very, very important to know what type of medication that you on, be it from oral medication, metformin, gluburide, Januvia, all those, they have so many drugs out there, versus insulin, what type of insulin, or different combinations of insulin. How much are you taking at night? Keeping a record. Keeping a record for me so I can see, so I can make adjustments to make sure that your sugars are where they need to be. And not only that, you need to make sure, if you have a diagnosis of diabetes, that you're taking your insulin as prescribed. I had a recent incident with a patient who I assumed that they were taking the insulin correctly, based upon what the history that they were telling me, and come out to find out that they were not. So then a nurse came in and caught it, and I thank God for that nurse, so we can get better controls of those sugars. So that way there will be no more nerve damage in regards to the eyes, no more nerve damage as far as neuropathic pain anywhere else in the body. So God be the glory on that. The mildest grade of what they call of nerve damage is what we call neuropraxia, which is Neurapraxia, which is a reduction or a complete block of conduction across the segment of the nerve with axonal continuity to conserve. Now let me explain what that is. Think of your nerves as electrical wiring. So, like electrical wiring going through the house, just like I told you guys to think about your blood vessels as plumbing. So, we're going to think about, hey, Kimberly Cole, thank you for joining on. Please like, invite, and share as you come on. We're talking about nerve damage. So, think about your nerves as the electrical system of your house. So, you have wires that are encased in what we call which we call myelin or a myelin sheath, and the nerves travel in that. So think about an extension cord. If you open up the extension cord, what do you see? You see wires. So your nerves are what we call wires, but it's protected by a myelin sheath. So how do we damage that? So we're going to get in that in just a little bit more. More specifically, the dysfunction or paralysis without the nerve sheath continuity. So that means like if that sheath, or just think about that myelin is destroyed, or you take the covering off an extension cord, the wires are just open, right? So they're just open and they're exposed to the elements and all that other kind. So they cannot conduct properly to get to from the power source to where it needs to get power to. So let's say for infant, I'll use the example, the television is plugged into the wall, and from the wall it draws power to power the television or to charge your phone. So if you have a short in the cord, how many of you have bought so many battery chargers or cords because there's a short in it, because it's not taking the power from the source, and through that cord there's a breakdown, be it in the myelin sheath, or the coating of the cord becomes weak and don't hold those wires where it needs to be, so the power from the source can't get to your phone or to the television. So that's how it works in the body as well. If there is a damage or bruising to the outside of the nerve, the power source, which is your brain, which tells your body or your hands to move, it gets scrambled or it doesn't get there. Okay, so that is what we call a conduction problem. Okay, then there's called this. I don't even want to, like I said, I'm trying to stay away from all this medical terminology, so I'm not even going to mention those words. But for those of you that are medical providers, you need to look up axon motesis, and which is again the endoneurium and epineurium and Schwann cells, tubules, and all of that. That can be damaged, which can also cause problems with conduction or neural problems. So the next thing that I want to go into and skip all this medical jargon so you guys can understand how some of the causes. Let me go ahead. Neural injury or acute injuries are most common in dislocations, what I described that was documented biblically. The radial nerve palsy. One of the things I want to talk about right here is with a diagnosis of carpal tunnel. You have a band of tissue here, and most times people have carpal tunnel because they do repetitive motions with their fingers. Someone that might work in a factory, or a factory worker, they do the same thing over and over with their hands. Or someone who types a lot, or someone who texts a lot. How about that? I'm seeing a lot of thumb stuff going on. But there's nerves that travel from the head down through the spine, throughout here, through the arm, down here, and there's a band of tissue there. So when there's repetitive motion over extensive period of time, like hours, days, years of doing the same thing over and over again, those nerves in that band or sheath that goes through here, it gets inflamed. And then by that band of tissue being in there, the nerve swells and it hits against the band of tissue, and then that's when a person gets the numbness, the tingling, and sometimes the shooting pain going up their arm, which wakes them from their sleep. Or either you can tap here, or push this like this, what's called Fresnel's and Tinel's sign. Those of you who are medical providers out of there, you know what I'm talking about. Those are the two tests that you need to do in regards to your part of your examination for people who are complaining of nerve issues that sound like carpal tunnel. Those are the two tests that you need to perform and document for that. So what do we do for that? Anti-inflammatories or bracing or anything like that. That's what we do for that. So nerve damage can be from dislocation. Nerve irritation can be from repetitive things. But one of the things that they talk about, which I really admire how they broke this down in regards to injury or damage. You can also nerve irritation, entrapment. What is entrapment? That means that you have bones, nerve. Always remember, bones, nerves, and blood vessels most often time run together. So when there is a bone break, it can damage a nerve. It can even also cause bleeding by damaging artery or a vein or something in that area, which orthopedic surgeons, orthopedic doctors, which is a fancy name for bone doctors, are familiar with that. But if there is any nerve damage, it definitely needs to be addressed. Putting your Sometimes people cut themselves, lacerations of nerves, that is nerve damage. Can those nerves be sewn back together? Yes. Sometimes a complete severing definitely can be sewn back together. If it's a partial tear of the nerve, we sometimes those nerve endings, even if, like, say for instance, it's just partial, um, and there's a connection, your body has the ability to reconnect and regenerate those nerves that may have been severed. Okay, stretching a nerve around is what we call stretching the nerve. Okay, that can be done. Okay, what they call high velocity trauma caused by a motor vehicle accident. Yes, you can high velocity and speeds, like they call it when you're hit from behind and you jarred real hard and janked real hard. That can not only cause bone problems, muscle problems, but it can also cause nerve damage or nerve inflammation in those nerves, because this is how I explain it. This is your skull. Your skull holds your brain, and your brain has a brain stem, which is known as a spine or the spinal cord, and it travels down what we call vertebrae. You have vertebrae in your neck, you have vertebrae in your chest, you have vertebrae in your lower back, and you have vertebrae in your lower sit bones. And in between each vertebrae, God is so amazing how He created. We have discs, and those discs are like shocks in a car. So and in between each vertebrae and disc, nerves come out. And guess what? God created us with muscles in between each one of those vertebrae, and what we call erector spinous muscles that travels down the back, that holds everything in place. And when it holds everything in place, it allows those nerves to be free to and not free to conduct from the source what the body needs and how it needs to be done. Now, when there is a car accident and there is a jarring, sometimes those things get moved out of place. Bones get moved out of place, discs get moved out of place, and those bones and discs can fall down on nerves, causing sharp shooting pains, dull aching pains, or muscle spasms, because now it's like you're getting electric shocks, because a nerve is being touched by something that it should normally not should be touching. So what is important in making that diagnosis? Of course, history and your physical exam for your providers that are out there. Get imaging. Most oftentimes, we start with an X-ray, CT scan, move up to an MRI. MRI can show us more than an X-ray does. X-ray just shows bone, will not be able to show us a tendon or a nerve. CT scan can show us a little bit more. MRI is more in-depth study, will allow us to see that. If that ever happens to anyone, what do? We give anti-inflammatories immediately. We call it the RICE, rest, ice, compression, and elevation, and physical therapy right away. We do anti-inflammatories with an acute motor vehicle accident or trauma. You should not be given an opioid script right off the rip. I've talked about this when I talked about the opioid crisis. So anyone, hey, Bishop, thank you for joining on. Hey, Blessed Angel, thank you for joining on. Any one of you under the sound of my voice, if you're ever in a car accident and someone gives you an narcotic script right away, run. Do not take it. You don't have to get it filled. Most oftentimes you trust those doctors and providers who are providing your care. You would think that they would know what they're doing and doing things moral and ethically. You should not get an opioid script. There's a difference between an opiate and an opioid. Opiate is it's in its natural form from the poppy seed heroin. Opioid is a synthetic form of an opiate. You should not get an opioid script if you in a car accident and you've been jarred, unless you've had a car accident and you had surgery and they're trying to manage your pain 24 hours after surgery and then stop the opioid script right after the 24 hours worth of surgery. You should not be on an opioid script your whole life. You should not be on an opioid script for 10 years. You should not be on, that's not how that works. But guess what? The opioid epidemic has caused this problem, and we're in the midst of trying to make things right. So part of me talking about this, even though we're talking about nerve damage, is for me to educate you on as far as pain management is concerned, because nerve damage does cause pain. But does it require an opioid script? No, it doesn't. So let me get back to where we're talking about the physical therapy. The physical therapy is very important when someone have nerve damage or have been in a car accident, because it does a couple of things. It makes those muscles that have been jarred that I described, make them stronger so they can hold things in place. Guess what? Exercise hurt, because anytime you do any exercises or anything like that muscle wise, you break down that muscle to build it back up for it to be strong. And yes, some pain is associated with that. And you guys heard no pain, no gain. So physical therapy is very important in nerve damage situations. Okay. Um, if there is a complete tendon tear or ligament tear or dislocation, of course, you would not do any physical therapy, and that you need to repair to put things back in place surgically, the way your body was originally created. Now, some people I know, based upon your, hey Jamie, thank you for joining on. Some people that I know, they say, I don't want surgery. They've had a tendon tear or ligament tear, that you have that right. But at the same time, you got to know, especially if it's a shoulder joint or a knee joint, these are joints that you use a lot. So if you use something a lot, it's going to take a very long time to heal. And if you're using it a lot, there's going to be pain associated with it, and it may not heal properly as it should. Okay. Hey, Gwendolyn, thank you for joining on. Please like, invite, and share. Okay. So motor vehicle accidents, again, things of that nature that jars a person or falls or anything like that can cause some type of nerve damage. Okay. Or injuries to nerves. The pathophysiology, like I said before, and let me see if I can find this real quick, where they break it down, the different types of mechanisms of injury. Okay, so I talked about that. I talked about regeneration. I talked about that. Um, let's talk about. I talked about trauma, about cutting, lacerations. Also, there is also in what we call crush injuries to the nerves. That is another injury where the actual nerve is crushed. Um, that can be from a fall, that can be from a car accident, that can be from a lot of things, where things are hands being crushed in doors and things of that nature, injuries on a job. All of that can be what we call crush injuries with the nerve. And the nerve, if it's treated appropriately and in an acute state, of course, there is going to be some pain associated with that, but there can be some regeneration and healing in regards to that, in regards to the nerve being healed. Okay, so one of the things that I wanted to talk about quickly too is the, let me see if I can find this right quick. Nerve, acute accessory nerve injury. Let me look at this right quick. Um, Give me 1 second, guys. I'm scrolling through the computer here to talk about this. You can also, a nerve can be damaged to what we call, due to what we call ischemia. And that's a fancy word for lack of blood supply. So if, of course, remember I said most bones and nerves travel with blood, bones, nerves, and vascular supply. If that vascular supply is anytime interrupted, because your blood is what brings oxygen and feeds the tissue so it can stay alive. So if there is any type of situation outside where there's some type of trauma, or be it that blood vessel ruptures like in stroke, or if that blood vessel gets filled with a clot like what we call a also again a stroke, that area in from the brain, even peripherally, that tissue can be damaged and also damage that nerve. And then if the for a long period of time, if there's a period of time where it's very, very long, where it becomes ischemic or lack of blood supply for a long period of time, which will cause tissue death and dying, it can be in certain situations irreversible. That's because that tissue is dead. But again, we serve a mighty God. I've seen miracles. And but anyway, I have to explain the natural side of things along with the supernatural side of things as well. I talked about traumatic, neurologic, um, and neurologic means where the nerve itself gets inflamed. I talked about that. So and then there are certain situations where we talk about nerve damage, where there is what we call a demyelination process. Where, remember I told you, you think of your nerves as an extension cord or wires in the house, and most wires are encased in a plastic or extension cord, and then wires travel through. What is demyelination? The outside of that cord is removed, and we call that um, demyelination, or autoimmune diseases, where the body attacks itself and removes that myelin sheath. So that is like in multiple sclerosis. That can also be in ALS. That can be in all a whole bunch of nervous disease, Parkinson diseases. Parkinson's disease is more so in the brain, the substantia nigra. You can look that up. Neurology was one of my favorite subjects in medical school. But the substantia nigra in the brain, the cells in there become, that only way I can say it, become demyelinated. And the main substance, which is acetylcholine or dopamine in that area, is not being produced like it should, which causes the disease. So even though we're talking about nerve damage, you got to remember that your brain is one big nerve. So I could touch on that just a little bit. I've talked about Alzheimer's disease in one of my talks before, which is been associated with, one, lack of sleep. Alzheimer's disease have been associated with vitamin D deficiency. Alzheimer's disease has also been associated with bacteria and germs from your mouth, because your mouth is close to your brain. So all three of those can cause brain damage or nerve damage. Again, like I said, your brain is one big nerve. So if a person has Alzheimer's disease, eventually it end stages can be somewhat alarming because a person forgets not only the people that are around them, forget who they are, but they forget how to do things. They forget how to eat. They forget how to swallow. They forget all those things. So, and all those things takes nerves to do. But if the main power source is damaged, that's like throwing a wrench in your fuse box of your house that shuts down the wiring in the whole house. So I would be remiss not to mention some things that affect the brain along with the nerve damage things that we're talking about tonight, per someone's request. Okay, so symptoms again can be pain, can be pain, like I said before. Most medications just do the surface work, which causes what we call um, neuropathy. There are two main medications that is out there that is known to treat neuropathy or diabetic pain or nerve pain. One is Lyrica, the other one is Neurontin or gabapentin. Those are just treat surface pain. But another thing that can cause nerve pain or nerve damage is chronic inflammation. And I have talked to you guys about chronic inflammation before and what causes chronic inflammation, right? Do you guys remember what some of the things that cause chronic inflammation? For those of you that have been out there listening for quite some time now, it's what you eat. Yes, what you eat. Hey Tika, thank you for joining on. Hey Carl, thank you for joining on. Please like, invite, and share. So, what causes chronic inflammation? What you put in here? So, if you're someone that eats a lot of junk food, that's potato chips, cookies, pop. Um, oh, I have a story. This is a true story, and this goes really well with what I'm about to tell you about nerve pain. I have a patient of mine. She's been with me for maybe 4 or 5 years, and when I explained to her all the stuff that I'm explaining to you guys, she was real serious about her eating habits. And so she released a tremendous amount of weight. And she said, Dr. Grace, sometimes I want to eat a sandwich, but I'm eating wheat bread. And I was like, okay. I was like, well, what is going on with you? Her pain. She was like, I've been in a lot of pain lately. And so we were talking. I'm trying to figure out why is her pain level where it is now. And I'm thinking maybe it's cold, maybe it's the change of weather. So while she's talking, and she's talking to our student nurse practitioner, I go into the kitchen and I go look at the bread. It's wheat bread, all right. Remember, I told you guys there's a difference between wheat bread and whole wheat bread. They're two different things. And I told you there is a play on words. All bread is made from wheat. So there is a wheat bread, which is really white bread dyed brown, but they put wheat bread on there to make you think you're eating better, but you're just eating white bread that's dyed brown versus whole grain wheat, which is a lot heavier. And I told you guys to go to the grocery store and do the test yourself. Whole wheat bread or Wonder Bread, white bread, and whole grain bread in your hand and see how much heavier it is. And she can trace her pain back to when she started eating sandwiches with that bread. I'm not making this up. You can't make this up. This is so true. So what causes and she's goes to a pain clinic and she was getting all her normal treatments, but her pain was so bad. Every time I come, she was like, I need an injection, I need an infusion, I need you to help me. But now we understand what the culprit was, and she thought she was doing right. So those of you that are under the side of my voice, nerve irritation, nerve damage can lead to permanent problems. So chronic inflammation is one of the things that can also cause nerve damage. So what do? You got to make sure that you're eating the right things. Those of you under the sound of my voice, I tell you that you need to do a good flaxseed oil or fish oil, which helps keep the inflammation down in the body. I also tell you guys that you need to be doing some type of alkaline water. Not every day, not with every meal, because you drink alkaline water when? Between meals, which helps bring the pH in the body, which helps decrease the pH acidity in the body, which brings pH up, which helps keeps the inflammation down. So as you can see, everything that I have been telling you, to whatever topic that you want to discuss, I guarantee you it would lead back to your food choices in regards to treating the whole man. Okay. All right, that's very, very important that you understand that. So let's go back to nerve damage with stroke. We talk about hypertension. I talked about hypertension last week when I talk about strokes and what the type of strokes are and how it can damage the nerves. All of that goes together too. It leads to the same thing. The same thing that you would do to control blood pressure would be also good for maintaining the health of your nervous system. Yes. So the myelin sheet is made by a particular protein, and that protein needs to be kept strong. So how do you keep that protein in on your nerves strong? You have to keep your immune system up. So most of the time, what you need to do in regards, those are your antioxidants. Your antioxidants is vitamin A, E, C, and D and K, which is your fat solubles that helps keep your immune system up, but you have to take them in a certain combination. You can't take certain vitamins together because one will cancel the other one out. If you want to know how to take vitamins in certain combinations, that is a good time for you to get in touch with me at 248-356-1111. That's 248-356-1111. So I can tell you how you need to take your vitamins in certain combinations, because certain vitamins cancel each other out. That's why I do not believe, even though for financial reasons for my seniors, I do put them on a multivitamin. But multivitamins, I guarantee you, they may work for you, may give you your energy, but sometimes, well, I'm not going to say sometimes, telling you right now, in that multivitamin capsule that you're taking, all the things that they list, they might be in there and they may not, because most vitamins are not FDA regulated. They're not regulated by the Food Drug Administration, because vitamins are just not. And so, since they're not regulated, people can make claims that things are in there that are really not, or put other things in there as substitutes. And all those vitamins, I promise you, something is canceling something out. So that is why at Bethesda Holistic Center, in regards to our concierge services that I've been telling you about, that we do vitamin testing. So we tell you what you're exactly deficient in, tell you to the milligram what you need to do to supplement that deficiency, and we tell you what food you need to incorporate in your food choices to supplement that deficient area. And we do it for 3 straight months. So you need to do that even to keep your nerves healthy. Because how can your nerves, be it pain, be it from trauma, be it from stroke, be it from whatever, how can your nerves be healthy if you don't have the proper nutrients for them to grow and to regenerate? Okay, so hey Kathy, thank you for joining on. Please like, invite, and share. So nerve damage has to be has a maintenance to it. It has a diagnosis, it has a treatment, and it has a maintenance. So all there's different causes for nerve damage, which I talked about, from high blood pressure, stroke, to trauma, also to a diagnosis of diabetes, also autoimmune diseases. I want to take a few more minutes right here to talk about autoimmune diseases. I have dealt within my 20 years of an experience as a medical doctor. Autoimmune diseases have spiritual spiritual root for it happening. Okay, there has not been one autoimmune case where I have talked to someone and there is a spiritual reason behind the autoimmune disease. So if you're someone under the sound of my voice that has been given a diagnosis of lupus, or have been given a diagnosis of vasculitis, autoimmune vasculitis, or ALS, or some type of demyelinating or Sojourner's disease, or anything that is an autoimmune disease, there is a spiritual root to that disease and it needs to be addressed. At Bethesda Holistic Center, not only do we pride ourselves in treating the whole man, but being able to talk about things spiritually in the spiritual realm, to know where the spiritual realm begins in regards to disease and to how it manifests in the body, for us to treat it at all levels, because you're a triune being, your spirit, soul, and body and mind. All of that goes together, that we're able to to all glory to be to God, of course, we're able to address disease and in its fullest potential that God has given us, spirit, soul, and body. So if you're someone in the sound of my voice that is experiencing any of that, you need to get in touch with us. You need to go to the website www.bw-center.com. You need to give us a call at 248-356-1111. You need to get in touch with us and for it to be addressed properly. It is very, very important that you do that so you can have an understanding of what needs to be done from a spiritual perspective, natural perspective, and a mindset perspective. Because if your mindset is off, everything is off. If your emotions is off, everything is off. So it all goes together. So please reach out to us so you can get the help and the direction that you need in regards to that. Again, there's another nerve damage can be from thermal. What does that mean? Versus heat versus cold. Frostbite. Being that we're in Michigan, sometimes we get sub below zero weather. Of course, what happens, your body wants to conserve core heat to stay alive. So peripherally, it starts shutting things down, that blood supply and nerves. And if the blood supply peripherally is shut down, that means the nerves in that area will, and the tissue in that area will be damaged. So that's why it's very, very important, if you're in a cold climate area, and number one, you know what the weather is going to be like. Number two, you got to make sure you dress appropriately. Number three, you got to make sure that you understand how the body operates and how it functions in regards to weather as thermal damage. Okay, so we talked about high blood pressure, we talked about diabetes, we talked about trauma, we talked a trauma being from motor vehicle accidents or cuts or crush injuries. We talked about thermal not only cold, let's talk about burns, about heat being on fire. There's first degree burns, second degree burns, third degree burns, fourth degree burns. First degree burns is like just the surface of the skin. You touch the stove or something and it's a little red. First degree. Second degree, this blistering. Third degree is down a little deep. Fourth degree, you down real deep where you're destroying tissue and nerves. Okay, so those are forms of nerve damage. Hopefully I covered everything. I even did a little bit of medical terminology for you providers that are out there. But you got to understand something. Even after trauma, be it trauma from anything, from the high blood pressure, diabetes, actual trauma from falls, accidents, even frostbite and burns are also forms of trauma but considered thermal. They're all can be damaging to nerves. What can you do once you come through that and going through that whole process of healing after going to the doctor, being treated, and all that other kind of stuff. Your body needs to be in a state of replenishing itself, even if they're using pharmaceuticals. Because I've told you time every show, for every pharmaceutical, it depletes the body of something. So if you're going through this whole process of a situation where there's some nerve damage, do you know what your deficiencies are in your body? If you do not know, here you are on Medical Monday with the opportunity to find out. Once you find out, again, we tell you how to supplement to the milligram dose, and we tell you what foods, the choices that you need to make sure that you're supplementing so we can put your body in a state where it can properly heal itself, okay, and be maintained. So please, if any one of you on the sound of my voice, I'm not on here just to be seen or just to be talking or just to hear myself talk. I'm on here so I can be a help to you guys that come on and listen to the video on the time when we on Medical Monday at 8 p.m., or you replayers. Please, that's what we're here for. Please go to www.bw-center.com. That's our website. Call us at 248-356-1111. That's 248-356-1111. Another thing I want to talk about is prevention. As we get younger and younger, or as we travel around the axis of the earth and go around the sun, which takes 365 years, 365 days to equal a year, I should say. Every time we do that, it is a progression in time. There is a we also do 4 areas in Bethesda Holistic Series, Bethesda Holistic Center. Like we said, spirit, soul, and body. But we also pride ourselves in 4 areas of preventative, or 4 areas. I shouldn't use that word preventive, but I don't want to use that word. 4 areas of health maintenance to keep your body where it needs to be so it can promote healing from the inside out. And one of them is anti-aging. The other one is energy. The other one is sports performance. And last but not least is weight wellness. So as far as anti-aging is concerned, we do have a product which is called Isogenesis, which helps promote telomeres from staying longer. Yes, your telomeres as you travel around the earth, those 365 days, those telomeres, which are caps on the top of your chromosomes, which are DNA, shortens. So you got to remember that your body, throughout your whole body, including your nerves, have cells which have nucleus, would have DNA, which have telomeres. You want to maintain the health of your nervous system by making sure that the cells divide appropriately. If there's any damage, that the cells go there, do whatever they need to do to make sure that your body is healthy. We talked about inflammation and all of that. But anti-aging, the telomere process also helps with maintaining your body's health, and even when it comes to maintenance of your nervous system. So I'm gonna post that after I get off here. I'm gonna post it in the comments section for you guys. So if nothing else, I highly recommend that you get a good flaxseed oil. I do flaxseed because I can't do fish oil because I have allergies. I'm being delivered of allergies from fish. But this fish oil that we have, that we promote, or that we recommend, is from Isogenics. It doesn't smell like fish. It has a lemony smell, and you know how sometimes people take fish oil and you burp fish after you take it. It's nothing like that. Blech. But it helps with inflammation, and the osteogenesis process product, which is a form of anti-aging, will help maintain your overall youthfulness, which also promotes a healthy nervous system. You please remember what I was saying. Everything is a building block. If there's any other topics that you guys want me to discuss, please message me so I can put it on our programming. As of right now, next Monday, there will not be a Medical Monday, but there will be one the following week. So this coming Monday, there will not be a Medical Monday. But what I want you to do, for those of you that are not on here every Monday, go to my YouTube, which is Medical Monday, Grace Patterson. Go to my YouTube page. There is a plethora of videos that you probably have not seen. Go and pick a video to watch next week, or go and review something that you need to go back and review that will help you, because the best health maintenance person is an educated maintenance health maintenance person. In order for you to maintain your health, you have to have the knowledge to do so. So next Monday, just go back to, or either go to the Medical Monday page on Facebook. All our videos are there. But YouTube, you could actually peruse and see those are there. And please, we will be back, not this coming Monday, the following Monday. I don't even know what that date is. Does anybody know what that date is? I'm gonna look it up. I'll tell you in a minute what that date is. Let me see. 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 Oh, can you guys believe we're already at the end of the year? Yes, we are at the end of the year already. Wow. We're in September. So let me see what we got cooking here, guys. As far as the date is concerned, where's the calendar? Where's the calendar? Where's the calendar on my phone? Okay, so next week will be October 1st. Woo! Next Monday, October 1st. So I will be back October 8th. So no Medical Monday next week, but I have a plethora of videos that you can look at. For those of you that have been using the products that I recommend, please go to the Medical Monday page and post your testimony. There are so many of you, be a video testimony or a word testimony. Video testimonies tend to be a little more effective, but I would really love for you guys to do a video testimony on the products that you have been using, or just do a video testimony how Medical Monday has changed your life. Can you do that? Even if you have not partaken in the product purchases or anything that we recommend, how the information has given you the guidance that you need to be the best you that you can be. Okay, that will be most helpful for us. Please go to Medical Monday and do your testimonials, please. It's very important that you do that. It's 9:01. I am Dr. Grace, managing owner of Bethesda Holistic Center and Everything New. Thank you for tuning in on Medical Monday. We're not going to be on October the 1st, but October the 8th we will be back. Please message me for any topics of discussion, anything that you want me to talk about. I'll be more than happy to do the research and come forth with the information that you need for you to be the best you that you can be. Go to www.bw-center.com is our website. And if you want to make an appointment or find more about our concierge services, give us a call at 248-356-1111. That's 248-356-1111. Thank you so much for tuning in to Medical Monday. Grace and peace. God bless. Bye for now. See ya.